Hey guys, this is Camus. Nathania and I chose the topic nurse burnout, and some of the things we'll be talking about is risk factors, signs and symptoms, and preventing nurse burnout. According to Plus One, a peer review source, burnout is a syndrome characterized by the combination of emotional exhaustion, depersonalization, and reduced sense of personal fulfillment. According to nurse.org, 15.6% of all nurses reported the feeling of burnout, and 50% of those nurses that felt burnout said they had no plans on leaving their organization. According to the nursinglicensure.org, risk factors include long shifts, high stress environments, working in acute care settings, graduate nurses, being single or divorced, or being young. Some causes of nurse burnout include not caring for themselves and putting everyone else first, working too many hours and days, and lack of proper training. According to the semanticscholar.org, there are 6 stages of burnout. The first stage being pre-burnout, which is where you're energetic, enthusiastic, and idealistic. Then there are 5 more main stages. The 5 main stages include mental and physical exhaustion, indifference, failure as a professional, failure as a person, and then complete burnout. Signs include depersonalization, feeling overworked, feeling underappreciated, not wanting to change, constantly fatigued, and lack of enthusiasm. Some ways to prevent nurse burnout include nurse residency programs, decreasing the nurse to patient ratio, reward programs, counseling, acknowledging nurse burnout, reducing stress, utilizing coping strategies, and having nurse resilience. Preventing nurse burnout includes nurse residency programs, lowering the nurse to patient ratio, reward programs, counseling, acknowledging nurse burnout, reducing stress, utilizing coping strategies, and having nurse resilience. As far as prevention, reward programs are a great idea because everyone likes to be recognized, and recognizing someone can go a long way in preventing nurse burnout. According to the nursinglicensure.org, having a nursing residency program helps the nurses because it helps them familiarize themselves with their new profession, which will ease anxiety and stress levels, decreasing the chance of burnout. Some ways to reduce stress include identifying your stressors, setting boundaries, practicing self-care, delegating when possible, asking for help, and learning to say no. In order to reduce stress, you have to figure out what are the stress signs, and some of those signs include no time for relaxation, becoming forgetful, having poor time management, and having a change in appearance. Unplugging is another way of reducing stress, and ways you can do that is just by taking time off work, not overthinking about work after you leave, and knowing you did all you could that day. As a helpful person, it's known that it's hard to say no, but you have to learn it's okay to say it. You can't please everyone, and you have to make room for yourself. Setting boundaries will also help reduce stress, and ways you can do that is not taking uncomfortable assignments, not doing tasks that make you uncomfortable, and knowing your self-worth. Asking others for help is great because you shouldn't take the pressure of knowing and doing everything. You can always ask others, and the right people will respect you for asking. You have a potential to gain friends, and it's proven to help reduce stress. A good way of reducing stress is having a good healthy lifestyle and diet. And good ways to do that is exercising, staying away from unhealthy foods, and not developing unhealthy habits such as drinking and smoking. Some ways to increase nurse resilience is to have colleague support, the use of mentors and role models, the feeling of making a difference, having team support, and having organizational support. A few more of increasing nurse resilience include the use of debriefings, feeling competent to meet the needs of the job, positive reappraisal empowerment, and having the sense of accomplishment. Positive reappraisal empowerment, and having the sense of accomplishment.
Hi guys, in today's presentation I want to talk to you guys about nurse burnout, more specifically in relation to cultural impact, patient safety, patient care, communication, as well as ways to prevent nurse burnout. Now, what is nurse burnout? Nurse burnout is the physical, mental, and emotional exhaustion nurses experience. Nurses working in high-stress areas such as critical care, oncology, pediatrics, and the emergency room reports the highest levels of nurse burnout. Now, in terms of who it affects, nurse burnout does not discriminate. In fact, nurse burnout is a worldwide phenomenon. There's a high proportion of nurses in North America, Europe, and Asia who experiences burnout. Also, there's a significantly higher job turnover among nurses who experience burnout. Now, I think it's important to add that there's an association between nurse burnout and patient care culture. According to the Joint Commission, safety culture is the beliefs, values, attitudes, perceptions, competencies, and patterns of behavior that determines the organization's commitment to quality and patient safety. In other words, safety culture is the sum of what an organization is and does in pursuit of safety. This involves leadership styles, event analysis, communication, reporting, and emphasis on prevention of compromising events rather than overall punishment. Does nurse burnout impact patient care? The short answer is yes. According to the National Institute of Health, higher levels of burnout were associated with lower ratings of quality of care. These findings suggest that reducing nurse burnout may be an effective strategy for improving nurse-rated quality of care. According to the World Health Organization, quality of care is safe, effective, timely, efficient, equitable, and people-centered. This all comes together to improve desired health outcomes for the patient. This overall is important because it is vital for further reduction in mortality. With this in mind, if a nurse is experiencing burnout and symptoms such as exhaustion and depersonalization, they may be less inclined to take steps in the promotion of patient safety culture and quality of care. This then in turn impacts patient care, patient experience, and the nurse's overall functioning. Therefore, nurse burnout impacts patient care by resulting in the patient having an increased risk for falls, infections, skin breakdown, and so forth. The nurse may also overlook life-threatening complications, delay proper interventions, as well as show signs and symptoms of compassion fatigue, which includes self-isolation. With this said, patient satisfaction, outcomes, safety, and even patient mortality can all severely be impacted by nurse burnout. According to the NCBI, each additional patient per nurse was associated with a 7% increase in the likelihood of mortality within 30 days of admission. Communication is also impacted by nurse burnout. Nurses experiencing burnout may be more inclined to leave out vital information to patient, disregarding patient concerns, and may have poor communication with other staff members. And due to the effects of depersonalization, feeling overworked, underappreciated, and constantly fatigued, burnt-out nurses may also compromise patient education and teaching. The nurses may not take the necessary amount of time to provide patient education, or they may relay incorrect information. The nurse may also miss vital information such as subjective data from the patient. To prevent nurse burnout, we must first acknowledge that nurse burnout is real. We cannot find a solution to a problem we do not acknowledge. From there, taking advantage of nurse residency programs to promote a smoother transition into the career, as well as improving nurse-to-patient ratios may be beneficial. Hospitals can offer free counseling to nurses as well as implement rewards program. Organized management is very important in the fact that it can promote psychological well-being of the professionals. And finally, reducing stress and increasing nurse resilience may also help to prevent nurse burnout. Now, before we get to the point of having to reduce stress, we want to avoid stress. Given the work, environment, and lifestyle of a nurse, stress avoidance strategies such as having a balanced diet, getting enough sleep, and taking mental breaks may prove to be a challenge. Tips to reduce stress include exercise, listening to music, and taking time out for overall personal care and relaxation. As nurses, it's important to say no to overtime, unwanted shift changes, set boundaries, ask for help, and create a support network. Nurse resiliency is the ability of a nurse to accurately perceive and respond well during stressful situations. Resiliency helps migrate moral distress and burnout. It involves utilizing different coping strategies to minimize your stress. These coping strategies involve confronting your fears, maintaining an optimistic and realistic outlook, a work-life balance, being responsible for your emotional well-being, as well as engaging in formal and informal debriefing after a stressful event. In other words, just simply vent. As stated before, nurses experiencing burnout may have a harder time providing quality care. According to the Nurse Center blog, the quality of patient care decreases as the number of patients in the nurse's care increases, and unsafe staffing levels were associated with increased mortality for patients. Before I go, I want to leave you guys with ways to avoid nurse burnout. Pay attention to what and how you're feeling. Determine why you started practicing nursing. Deep breathing, taking breaks, as well as considering a change. Travel nursing is awesome, and sometimes all a nurse needs is a change of environment.